The impact of the coronavirus pandemic was so far-reaching in such a short space of time that most were convinced it would eventually dominate the global scene. More than a year in, nations are still battling to bring infections under control. The global count of COVID-19 infections has exceeded 170 million, and new infections are recorded daily. In Nigeria, from a single case imported from Italy on February the 27th, the numbers have exceeded 166,000, and the country, like so many others, is experiencing a second wave of infections. There were 5 labs all around the country that could isolate and identify COVID-19. This was possible because of the exposure in 2014 to Ebola.
We started an incredible expansion of laboratory capacity in Nigeria. We're now at 120 labs, about 70 in the public sector, the rest in the private and corporate sector. So I think one of the collateral benefits of this response has been the expansion of laboratory capacity in Nigeria.
By mid-April and early in Nigeria's outbreak, when confirmed cases in the country were less than 400, the European Union donated a whopping sum of 50 million euros to Nigeria for its fight against COVID-19.
And we reached out to the United Nations as well and said, you know, this is an opportunity to see multilateralism in practice. So let's put all our efforts together, let's pool it, and really, you know, step up to the challenge this time.
At the end of March, due to community spread, a lockdown was imposed in Lagos, Ogun State and the FCT. All schools, airports and public places were closed. Schooling ground to a halt for some, others took it online. Many businesses collapsed. Government responded with distribution of relief packages to cushion the effect of the pandemic. Some business owners became creative to stay afloat. Mrs. Tonya Lawani has been in the hospitality business for 15 years. Hers is one of the companies that took a hit from lost opportunities during the lockdown. Mrs. Lawani sent her workers home as was required of lockdown rules. It was a perplexing time. Then she had an idea.
We had a training years ago, over a decade ago actually, and we were trained for sanitizer production.
She used existing production lines to make sanitizers to be distributed at no charge to people who couldn't afford them. But even people with money came because sanitizers were sold out. Then the unexpected happened.
Sanitizers got to a pharmaceutical company and they laughed. And then they called to say they saw our product and, you know, they liked it and do we produce, can we work with them to produce, can we contract manufacture for them? At this point, we ventured into sanitizer production, and this is what we have this is a new product we have added to our products, the alcohol-based hand sanitizers, disinfectant surface spray, which is alcohol-based as well, disinfectant hand wash. So all those products birthed from the pandemic.
Not everyone weathered the period quite as well. Business is booming at the Murtala Mohammed Airport as newly disembarked passengers look for taxis to their various destinations. This is in stark contrast to late March of 2020, when most air traffic was stopped to control the spread of the novel coronavirus, which was assuming alarming proportions.
We start calling each other that if you are buoyant, please try and help others.
Plans to disburse monies to less fortunate cab operators through the association's purse fell through because multiple signatories living in different parts of the state were constrained by lockdown rules and banks were shut down. That's where food packs, bought with monies provided by a private sector-led organization in Nigeria, CACOVID, and international bodies came in handy to reduce hardship.
Funds we are giving to women affected by COVID-19 and also to vulnerable groups, in partnership with the banking system and the National Social Safety Net Coordinating Office.
It soon became clear that regular hospitals could not contain the growing number of infected patients, especially with the need to isolate them from others. Public buildings were cleared out to serve as isolation centers. Some tents were also hastily erected by the government and the coalition against COVID-19 to house the infected away from others. Curiously, the pandemic is not as devastating in Nigeria as in Europe and the Americas, though rules of physical distancing, mask wearing and hand washing are regularly ignored. The cost of managing the pandemic in Nigeria has been enormous. The budget allocation for health in 2020 came to about 427 billion naira. Effort for the COVID-19 response came mostly from special funds and the private sector. It took the combined effort of the federal government, development partners and the private sector to wrestle the virus to submission.
Pandemics affects everybody. So nobody is safe, as they say, until everybody is safe. So the UN family were able to get together and support the country, and we're pleased to see a year later Nigeria has done much better than anybody expected.
Donations towards the fight against COVID-19 from the UN Basket Fund, the Coalition Against COVID-19 and government have run into tens of billions of naira. The US government donated 200 ventilators and 50 came from the Basket Fund, which also provided an initial $2 million for the procurement of essential medical supplies.
We were able to get further resources from Canada, Norway, Switzerland, Gates Foundation, MacArthur Foundation, Dangote Foundation. Overall, we were able to raise about $73 million.
We procured about 10,839,000 PPEs. And those were comprising 459,783 test kits. We brought in 50 ventilators. We brought in oxygen concentrators. We brought in resuscitators. We brought in swab collections and extraction kits. We brought in gowns, gloves, face masks, and face shields, etc.
Infections peaked in July 2020, then the daily numbers started to decline, giving hope that it would soon burn out. Those hopes were dashed when cases were on the rise again by October. The Presidential Steering Committee attributed this to the fallout of mass gatherings like the EndSARS protests, and daily infections in November surpassed those in July. The second wave had begun. Something else that distinguished the second wave from the first is the emergence of vaccines from several foreign companies. The concept of vaccine equity birthed the COVAX facility with the aim of getting vaccines to lower-income countries at no cost to them. On March 2, 2021, Nigeria took delivery of 3.94 million doses of the Oxford AstraZeneca vaccine via the COVAX facility.
Vaccine is an important tool, an important addition, so it was important to add that tool to the arsenal that was already in place in Nigeria.
The struggle to understand the new virus put pressure on researchers and research institutes, and Nigeria was the first to sequence the novel coronavirus genome. Experts say outbreaks will happen from time to time, so preparedness should be the watchword. And beyond that, collaboration is important for countries to move forward together.
Nigeria should continue to rely on the UN and other partners if the country is to effectively control the pandemic.
It's vital that you combine having not only development cooperation funding made available for specific projects, but actually have a real political framing of that. And the only way to do that is working, in support of Nigerian-led visions.
We need a strong National Public Health Institute with the resources, the capacity, the knowledge, the expertise to continue protecting the health of Nigerians.
Apart from increasing funding to the sector, experts suggest that the government should give tax waivers and incentives to healthcare-based programs, make health insurance work, and pay more attention to research and technological solutions to rebuild and strengthen the health sector. Only collaboration of the government with the coalition against COVID-19 and development partners, like the combination of the UN country teams, has resulted in timely control of the COVID-19 situation. How Nigeria fares during the rest of the pandemic will depend on how creatively she employs these pooled efforts.